carefully take them out, and then we have a model of your lower teeth and your upper teeth.
I just want to say that I'm currently holding your lower jaw.
That's it.
Oh, that's really weird.
How bizarre.
And if you hold the two together like that, you can imagine what food sees as it disappears down Beth's throat. So that's the last thing that food would see as it goes. But anyway.
Bye-bye food.
Yeah. So we have those models, if you like, are then placed on it's like a small vacuum cleaner almost, but it's called a pull-down machine. So it creates a vacuum, and then we have a plastic film which is heated up. It melts, and as it goes soft and begins to melt, it's then pushed down and pulled down onto the model by the vacuum former, and that forms a really, really tight seal around your teeth. We can then take those models off.
And I remember saying last time you were with us, we were talking about moulds, and you were saying it's actually quite a good idea to keep hold of the
Yes.
mould itself.
Yeah, the models of your teeth. If you have any crown work done, we have no problem if a patient says to us, can I keep my models? So if you've had a crown or a veneer or a denture even. So yeah, by all means, keep your models because they're very handy because first of all, they're an accurate representation of your teeth today, or in your case last week. So heaven forbid if you were to fall over and break one of your teeth, if you've got those models with you, the dentist can apply a putty to the back of that, and he can create a little another little mould, so I could then put that in your mouth and build up your tooth again, so it would be exactly the same shape and size as where you are now.
And you probably wouldn't make the bottom teeth as crooked.
I might not do
now. Right, so we've got these moulds then.
Yep.
If you were going to go for whitening, first of all, how white can you go?
Right. That's kind of dependent on the stains and how stained your teeth are. Okay.
Right.
It's very difficult for a dentist. If Joe Bloggs walks in the surgery and he's got quite stained teeth and he says, I want to go from this colour to Ross from Friends white or toilet bowl white, I would never say to a patient, yeah, I can do that, because I don't know how well he will react. There are actual certain shades of teeth. We have a shade guide which actually has kind of lots and lots of shades on it. But there's different colours. So there's like a grey tooth, there'll be a yellow tooth, an orange tooth, and then there's a kind of reddish tinge to teeth. Now, the grey shades are really difficult to whiten. So you can sometimes look at someone and you go, yep, that will get a really nice result with that. And they will whiten, but it takes ages. It's very, very slow. So it's not that the effects are unpredictable, but they're predictable. You don't know how quick it's going to be. Sometimes it's slowly, sometimes it's quick.
And how long then does the whole process take?
Right. With the setup that we've done with you, we've got you what we would call nighttime models or nighttime trays. So what you'll get with this is you'll get the tray that in this case fits on your upper teeth.
Shall I put it in? Shall I see if it fits?
You can try it and you'll see if it fits. Is the moment of truth.
Carry on talking.
I'm hoping it does fit.
Now you need to talk so we can turn that camera on, so you can look in that camera and show your lovely mouth guard.
It does fit.
It does fit. That's
and you
all
can
right.
still talk.
Because there's a member of my staff waiting by the phone at the moment to see whether she's got a job tomorrow. That's all.
That fits really well, actually.
No pressure.
It's like a second set of teeth.
Well, the thing is, you see, ideally you're going to sleep in that.
Okay. All right.
As well as whatever you're sleeping, but you're going to sleep in your trays, and you're going to put a gel inside those trays. Now that gel has to sit nice and tight against your teeth. So what we don't want a tray that's going to flop up and down and be loose. You want it relatively tight. They used to put little wells on the models so that the tray actually had little spaces in there, but they've now found that that's not necessary. So as long as you've got a thin bit of whitening gel against your teeth, it soaks in, and the way they work is it's not hydrogen peroxide, but it breaks down to hydrogen peroxide, and it's the peroxide that then gets inside. It soaks into the teeth very, very slowly, and stains inside your teeth are generally considered to be what they call it's a long chain molecule. So the stains are big molecules, and what the peroxide does is the free radicals in the peroxide, just like any kind of bleach, clean and whatever, it breaks down stains by breaking down the big molecules into small molecules, and the small molecules then aren't seen. They don't stand out as much.
And this isn't damaging to your teeth long term?
No. Now, generally, if you've got very sensitive teeth, we would use a 10% carbamide peroxide solution or gel. If you haven't got sensitive teeth, then we might use the 16%. But all the studies that have been done, 10% peroxide doesn't cause any long-term sensitivity. It doesn't cause any damage to the enamel. It doesn't cause any resorption of the roots, and it shouldn't cause any damage to the gums as long as the trays are fitting nice and tightly and you're not getting loads and loads of gel everywhere.
Okay, so I've got my moulds. At night then, do I put the paste on straight onto my teeth or into the mould?
No, you'd have, with the what I'm holding now is just a little syringe, and it has a little applicator tip that I should have prepared earlier. So that would be fitted together.
Okay.
And with a little applicator, what you would generally do is, I'll use this other tray here. So you take the applicator and you would put a blob, and a blob is, what I always say to patients is, a blob is about, how would you describe that?
That's like 0.5 centimetre, basically.
Yeah, a bit less than that. So it's
about 3 millimetres.
About 3 millimetre, a 3 millimetre blob. Yeah, and that would be placed on the inside front edge of all the teeth you wanted to whiten. And that would then squidge. So then what you would do is you would put that very carefully over your teeth.
Okay.
And it would allow the gel to run across the front of your teeth. You can do it on the back surfaces as well, but generally we just recommend just putting it on the front surface. So that would gently sort of squidge onto the teeth, and then the tray's in.
And how many nights in a row do you do that?
Right. You can do it 2 weeks, 21 days if you want. You can go as long or as short as you want. With a nighttime at-home set like this, you can control the whitening. So you might have a crown that seems to be whiter than your natural teeth. Now, crowns, although they'll clean up a little bit with a whitening gel, they won't whiten. So fillings, crowns, veneers will brighten up, but they won't whiten. So all you're doing is really refreshing those. So what you've got to be careful there is you don't want to be whitening all your teeth and find that suddenly all your teeth are really white and your crown looks quite yellow. So at the moment, if this crown is whiter, then whiten all your other teeth, and every morning just keep checking. And you think, oh, hang on, all my teeth are now the same sort of whiteness. Then you can stop there.
Okay.
So you don't want to go too much.
How exciting.
The best way we found at the moment is a much longer way of whitening. So what we recommend long-term for patients is whiten maybe 1 day a week or a couple of days a month over a period of a year to 2 years. So it's like really, really long. That doesn't cause any sensitivity, because it doesn't cause any damage, and it's every time it's just getting a tiny bit whiter, and a tiny bit whiter, and a tiny bit whiter each time. But it's like a year. So if you've got a wedding that you're going to in 3 months' time, that's not really going to be good for you. But you can then just keep topping them up a little bit, and that will get rid of the day-to-day stains and red wine, coffee, all those sorts of things.
Absolutely brilliant.
You're now going to do the entire show with that stuff on your teeth?
Because it's very comfortable actually. And to be honest, I've kind of forgotten I've got it in. We had asked for some suggestions for tooth-related songs, and big up to Chris Dennis, who said free.
Chris what, sorry?
Dennis.
Dennis.
Free all white now. He says he'll get his own coat.
That's